Extract 1. Questions 1 to 12. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
You hear a doctor talking to a patient.
Good afternoon. May I know what your problem is?
I'm having a severe stomach ache.
What do you feel?
I have heartburn and severe pain, doctor.
Since when have you been feeling this acidity and pain?
For the past 2 months, my stomach hurts after every meal. The pain persists even during nights.
Have you eaten any heavy food or something different in the last 2 months?
No, actually.
How severe is the pain? Let's say on a scale of 1 to 10, how would you scale the severity of the pain?
Well, I can say between 4 to 5.
Is the pain continuous?
No, it hurts only fleetingly.
Do you feel the pain after meals?
Yeah, probably because it hurts every time after I eat.
Is there any kind of food that bothers you much?
Yeah, greasy food.
Oh, I see.
Yes, at home we eat a lot of greasy food.
Where in the abdomen does it hurt? Tell me the exact point. Does the pain shift to your chest, shoulder, back, or across your abdomen?
It hurts in the middle. At times the pain moves across my abdomen.
Besides the pain, you said you have heartburn?
Yes, I feel a kind of sour taste whenever I burp.
Do you feel like this more during the day or in the evenings?
Both. I feel the acidity during the day and at night.
Is it getting worse whenever you lie down?
Yeah, I get an acid-like taste in my mouth.
Besides greasy food, are you getting some irritation in your stomach when you eat any other kind of food, like spicy food?
No, actually, we don't eat spicy food at home.
And tell me, how frequently do you have a bowel movement?
No, it hasn't changed. It's regular.
And tell me, how frequently do you have a bowel movement? And has there been any change in your bowel movements for the past 2 months?
Yes, it has become a little bit softer.
Is there any change in the color?
Yeah, it is greener.
Greener and not darker? Any blood in your bowel movement, or is it darker?
Not darker. And there wasn't any blood in my bowel movement.
Okay, let's first diagnose your abdomen to check from where the pain comes. You said you are feeling pain at the middle part of your abdomen.
Correct.
Does the pain stay there only, or does it move somewhere else?
It usually stays there.
Do you feel acidity and heartburn during the pain?
Yeah, you were right.
Do you have vomiting or nausea?
No, not now.
What did you eat today?
I ate meat and tomato sauce.
Do tomatoes give you any trouble?
Not exactly. I have been eating tomato sauce always.
Do you get any trouble when you have orange juice?
Yeah, at times.
How do you feel then?
I get a strange metallic taste.
You do not feel acidity then?
No?
Now, tell me, what do you do whenever you get stomach aches?
I take Alka-Seltzer at times. That gives me a relief from the pain to some extent.
Yeah, that should help with the relief. Do you take any Maalox, Tums, or Mylanta?
No.
Have you ever taken any medication on a consistent basis, such as Advil, aspirin, or Motrin?
I was taking Tylenol usually.
Okay, as I told you earlier, I'm going to examine your feces to investigate whether you have any kind of parasite. Tell me, do you either come from the tropics, or have you ever been traveling to any of the tropical regions or overseas?
Yeah.
Parasites that are found in most of the parts of the world affect the stomach. Besides, I want to check for any occult blood. You have mentioned earlier you haven't seen any changes in your feces, and it's only greener and not darker. Sometimes, if you have a hemorrhage in your stomach, then the digested blood could produce a chemical reaction so that you can have occult blood in your feces. In such cases, we don't see the red color or dark color of the digested blood. Therefore, a diagnosis is essential. Moreover, I would like to diagnose your upper gastrointestinal system through x-rays and contrast. You will be given a thick substance to drink, and then the radiologist would observe how your liver digests the substance and observe your stomach movements. Because I think that your pain comes from your gallbladder and not from your stomach, I will have to do this kind of diagnosis. After a thorough investigation, let me decide whether I should take the x-ray test or an ultrasonic study of your gallbladder. Do not eat any greasy food for now, and also do not have your dinner just before going to bed, because it could produce more acidity. Eat normal food and nothing spicy. I shall get back to you as I receive your medical reports from our lab. Anything else?
With so many medical tests, I'm afraid I have an ulcer.
I too have that kind of doubt. That is why I have suggested all these tests. I need to explain to you that an ulcer or other irritations in your upper intestines cannot be detected by x-ray at times. If the pain continues after having some antibiotics, you may have to go for an endoscopy. An endoscopy is a medical investigation in which a tube will be inserted through your mouth or nose, and then the specialist will observe your stomach, from the small intestines to the large one, and your gullet. Do you need any clarification?
No, doctor, thank you.
Good. Let us meet next week. Goodbye.
Extract 2. Questions 13 to 24. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
You hear a doctor talking to a patient.
What's the reason for your visit today?
Well, lately, I've been feeling really tired, and often I get frequent headaches and an upset stomach. Moreover, I've been getting a persistent cough for like the last 3 weeks.
When did these symptoms start?
I started feeling tired all the time about 2 months ago. Then, a few days after that, the headaches started. I got the upset stomach long before feeling the tiredness.
Are you taking any medications?
Only vitamins.
What vitamins are you taking?
I am taking vitamin C, and a multivitamin tablet daily.
Okay. Let me examine your vital signs.
How am I doing?
Everything is normal. No high temperature, and your blood pressure is also normal. Please wait for a moment here.
Thank you, doctor.
I see here that you have started feeling tiredness 2 months ago, and then frequent headaches. You're also suffering with an upset stomach and a persistent cough. Did you run a fever as well?
No, doctor.
Let me perform a quick physical checkup. Take a deep breath, hold your breath for a moment, and exhale. Repeat this again. Have there been any changes in your diet or your weight recently?
My diet is the same, as usual. However, I lost 5 pounds very recently.
Did you ever suffer from insomnia?
Well, it is pretty hard for me to fall asleep. I also wake up often during the night.
Do you drink or smoke?
No, doctor. Well, recently the ownership has changed, and I had to work a lot of overtime at late hours, even during the weekends.
I think you are suffering from pneumonia. Other than that, I do not see any other problem. The reason could be probably the stress at your workplace that causes headaches, upset stomach, and sleeplessness. For now, try to relax yourself and start doing exercises. Meet me again after you receive all the medical diagnosis reports. I'm going to prescribe medicines for bacterial pneumonia. Are you allergic to any medicine?
Not to my knowledge.
I want you to do a blood test and urine test to identify the bacteria Streptococcus pneumoniae and Legionella pneumophila.
Is it something serious, doctor?
Not at all. I doubt that could be bacterial pneumonia. Take levofloxacin, 750 milligrams orally, every 24 hours for 7 to 14 days.
I want to know my cholesterol level. When will I get the medical reports, doctor?
You will get the medical results in 2 weeks. Don't stress yourself. Everything will be okay.
Can pneumonia be prevented, doctor?
In most of the cases, pneumonia can be prevented. You can have a vaccine to defend against pneumonia once you get all these medical investigation reports. I would suggest Prevnar 13 pneumonia vaccine. That is very effective against 13 types of bacterial pneumonia.
What food should I include in my diet, doctor?
Have plenty of fruit juice and fresh fruits, yogurts, milkshakes, smoothies. Eat plenty of full cream milk or yogurt, or even ice cream, with light meals of lean meat, fish, or eggs, and cooked vegetables.
Thank you, doctor.
You are welcome.
Part B. In this part of the test, you will hear 6 different extracts. In each extract, you will hear people talking in a different healthcare environment. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen to the audio. Complete the answers as you listen to the audio.
Now look at question 25. You hear a conversation between a GP and a patient about recurring diarrhea. Now read the question.
So, Mrs. Johnson, it seems that your diarrhea has not cleared up.
Oh, no. I took the medicine you prescribed, but I am still having diarrhea. I've lost quite a bit of weight as well.
I remember in your initial appointment you said that your diarrhea was watery, yellow and foul-smelling, and that you were experiencing a loss of appetite and nausea. Now, along with this weight loss, I'm suspecting it is something else. Where was it you travelled to recently? Was it somewhere in Eastern Europe?
To Russia, at St. Petersburg.
Okay, so I think what you have is giardiasis. It is most common in the tropics, but is also found in Russia. I will need to...
Question 26. You hear a physician in the A&E department talking with a patient presenting with abdominal pain. Now read the question.
So, Mrs. Hardy, you're complaining of abdominal pain.
Yes, it won't go away and it has become more and more severe over the last day. I'm also feeling nauseated and hot and cold.
You are probably dehydrated. Have you had any surgeries in the past couple of years?
Yes. I was treated for an ulcer about 5 years ago.
Well, I can see that you are running a fever, and that you are tender in the right upper quadrant and epigastrium. I'm going to order an abdominal X-ray and blood test to help us get a better look at what might be causing your pain. In the meantime, I'm going to put you on intravenous fluids to avoid dehydration.
Question 27. You hear a ward briefing about a newly admitted patient. Now read the question.
Okay, so last night a 35-year-old man was admitted after he presented in the emergency department because of a rapid onset painful swollen right knee. There is no history of trauma to the knee or previous joint problem, and there is no history of significant medical illnesses. The patient feels generally unwell and has noticed that his eyes are sore. His initial examination of cardiovascular, respiratory, abdominal, and neurological systems was normal. His right knee was swollen, hot and tender with limitation in flexion. An X-ray showed soft tissue swelling around the joint. No other joint appears to be affected. Patient reported having recently travelled to Thailand on business. The probable diagnosis is post-infective inflammatory mucositis and arthritis, likely triggered by non-gonococcal urethritis. I have ordered urethral swabs to exclude chlamydial and gonococcal infections to get a cause for the urethritis and possibly for the inflamed knee.
Question 28. You hear part of a training on communication between providers. Now read the question.
I am here today to introduce a new role at our facility, as well as discuss some of the problems this new role is intended to deal with. First of all, the new role is Clinical Nurse Leader. We are assigning a clinical nurse leader to micro-units of around 12 beds throughout the hospital. The clinical nurse leader will primarily function as a liaison between physicians and patients, as well as a mentor to other nurses. As you all know, we have experienced a range of problems stemming from poor communication between providers. So one of the main purposes of this role is to get better information flowing faster so that decisions can be made more efficiently and more effectively. We think this will result in patients having a better healthcare experience, with fewer redundancies and in physicians having a better understanding of what happens to a patient when another provider takes over. Some other policies we are
Question 29. You hear a trainee doctor discussing stress with a senior GP. Now read the question.
Dr. James, you have been a GP for 15 years, right?
Yeah, that's correct. I've seen general practice change quite a bit in that time. There is an increasing workload and pressure on general practice, so much so that many younger GPs are choosing to work as locum GPs or choosing to work abroad. I mean, the big part of the problem is from the lack of physicians choosing to go into general practice.
I've heard quite a few GPs talk about their days getting busier and longer in order to cope with increased demand, which obviously makes it incredibly difficult to juggle working life and home life, especially if one wants to have children.
Yes, 12-hour minimum working days have definitely become the norm, not the exception. I'm of the opinion that the current state of general practice is completely...
Question 30. You hear a conversation between a nurse and a doctor about scheduling appointments. Now read the question.
So, Dr. Alex, I've already spent over an hour going through the list of patients for this morning's diabetic clinic. I'm trying to decide which patients can be seen by the nurse and which should be seen by the GP.
Let me see if I can help with that. I mean, we already have quite a busy day with the second-year medical students coming in, which is going to reduce the number of patients one of the doctors can see.
Yes, every day is a case of juggling priorities and complex needs.
That is definitely true. I also have at least an hour of reports and routine administration with prescriptions waiting for me. I wish it were easier to get some temporary support until our colleague on sabbatical comes back, but...
This is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about specific aspects of their work. For questions 31 through 42, choose the answer A, B, or C, which fits best according to what you hear. Complete the answers as you listen to the audio. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear a medical podcast on the guidelines for coping with Prader-Willi syndrome. You have 90 seconds to read questions 31 to 36. Hello, Mrs. Araceli. I am Dr. Gonzalez.
Hello, doctor. I would like to tell you something about myself.
Yes, please.
I have been married for 55 years and we have 3 children. The second child, who was born in 1964, had every kind of physical problem and was in the hospital for 10 months. However, we did not have a diagnosis until she was 4.5.
What does the diagnosis indicate?
Prader-Willi syndrome.
Prader-Willi syndrome?
Yes, it had a severe impact on my child in very complicated ways, mainly the damage of the 2 primary areas of the brain, the deletion of chromosomes 15 and hyperplasia. She is always feeling and thinking about food the whole time, akin to the feeling of starvation, and she never has the feeling of satiety. So this affects her daily life in an extreme way, and her tolerance level and the temper control, which is affected greatly.
Over the years, you would have experienced the communication skills of your doctor a lot. What is your impression in general?
We've been very fortunate for not having any bitter experience over the diagnosis. However, later on we have realized that he had suggested blood tests for her that were not actually required. That was the only bitter experience we had.
Actually, Prader-Willi syndrome is a complicated genetic condition that severely impacts several parts of the body. In infancy, this condition is identified by weak muscle tone called hypotonia, difficulties in feeding, poor growth, and delayed cognitive development. The patients develop an insatiable appetite right from the childhood, resulting in chronic overeating called hyperphagia and obesity. Some patients with Prader-Willi syndrome, especially those with obesity, also develop the most common form of diabetes called type 2 diabetes. The patients will typically have mild to moderate intellectual impairment and cognitive disabilities. Behavioral problems are very common, such as stubbornness, temper outbursts, and compulsive behavior. Sleep abnormalities can also be seen in the patients. Distinctive facial features such as almond-shaped eyes, triangular mouth, and a narrow forehead. Short in height, small feet and hands. Patients even have light-colored hair and unusually fair skin. Male as well as female patients will have underdeveloped genitals, delayed or incomplete puberty, and infertility is also common.
So is there any chance of curing Prader-Willi syndrome, doctor?
Yeah, but it's a lengthy process. Parents can enroll infants with Prader-Willi syndrome in early intervention programs. However, even if the diagnosis is delayed, treatments are available at any age. Therefore, for the patients with Prader-Willi syndrome, the types of treatment depend on the patient's symptoms. You can adopt any of the following steps that are suitable for the patient. Can use nipples or tubes for the patients with feeding difficulties. Special nipples or tubes have to be used for several months to feed the child with feeding difficulties, to make sure that the infant is fed completely and it has proper growth. The healthcare provider will monitor weight, height, and body mass index periodically to ensure proper growth. By supervising the daily food intake, the parents could prevent the overeating behavior that starts from 2 to 4 years of age. This will minimize food hoarding and prevent rapid weight gain and obesity. Growth hormone therapy has to be performed to increase lean body mass, mobility, and height. To reduce fat mass and improve movement and flexibility from infancy through adulthood. If the growth hormone therapy is given early in life, it may reduce or prevent behavioral difficulties. In addition, this can help improve speech, cognitive ability, abstract reasoning, and often promote information to be processed very quickly. It also improves sleep quality and resting energy expenditure. Growth hormone therapy is usually started during infancy or immediately after the diagnosis, and often continues during adulthood at 20% to 25% of the recommended dose for the patient. Many patients have trouble getting their eyes focused together. Such patients should be referred to a pediatric ophthalmologist. If necessary, an orthopedist will evaluate and treat the curvature of the spine called scoliosis. Sleep disorders are very common in Prader-Willi syndrome patients. Treating a sleep disorder in an early stage would help improve the quality of sleep. Muscle weakness is a serious issue among the patients with PWS. For children younger than 3 years of age, a physical therapy is essential to increase muscular strength to achieve developmental milestones. Generally, the patients have difficulty in controlling their emotions. Therefore, a behavioral therapy could help to control anger, obsessive-compulsive behavior, and stubbornness, including an obsession with food. Medications, such as serotonin reuptake inhibitors, may reduce obsessive-compulsive behavior and also help manage psychosis.
Thank you very much, Doctor. That's been really useful. Thank you.
Thank you, Mrs. Araceli.
Now look at Extract 2. Questions 37 to 42.
You hear an interview with a nurse about common problems in hospitals. You now have 90 seconds to read questions 37 to 42.
Hello everyone, I want to welcome you all today to this interview with the leader of the Australian Nursing Federation. Sally began her career in nursing in aged care, and she also has a background in oncology and emergency nursing, having held a variety of roles. Her areas of interest are standards and practice, leadership and patient safety. So, Sally, tell us about what originally attracted you to the field of nursing.
I always knew I wanted to do something in healthcare, but I think what drew me to nursing was the fact that nurses are uniquely positioned as advocates for patients. I liked the idea of working for and with patients to help in the planning and delivery of health services.
That's an interesting take on things. So now in your role as president of the Australian Nursing Federation, you work to promote and protect the profession.
Yes, that's what we do. I mean, it isn't just me. I work with a strong and experienced team to improve the interests of nurses and midwives in the country.
So you are here today to talk about some of the challenges that nurses face in the hospital setting. So what, in your opinion, is one of the biggest challenges facing nurses in this setting?
Well, it is hard to say which is the biggest challenge, but one that we have been hearing more about lately is the desire for physician integration in care teams. We have more and more locum physicians, which is good for the physicians because they get the flexibility in terms of time and location. But this means that there is a less of a chance for physicians to integrate with the rest of the team. It also means that we, the nurses, are doing double duty because these physicians don't communicate with the rest of the team very well. I think healthcare systems are realizing more and more that an integrated care model is the best for patients. Having physicians coming and going is not compatible with this trend.
That's interesting. I would have expected you to start with staffing shortages, which is a problem plaguing all areas of healthcare. General physicians have been trying to raise awareness for several years about the dramatic rise in their caseloads.
Well, yes, short staffing is definitely a challenge for nurses in any setting, but particularly hospitals. And this affects the profession in a number of ways. For example, nurses may not feel like they are doing enough, causing dissatisfaction and burnout. It can certainly be emotionally and physically draining when repeatedly you can't provide the care you think is necessary. This can lead to significant turnover in many healthcare organisations and settings. Also, most concerning is the fact that staffing issues are a hindrance to patient safety. Recent research shows that nursing shortages result in errors as well as higher morbidity and mortality rates.
And I would imagine that staffing shortages would lead to longer working hours. Is that true?
Yes, that is true. Nurses often work extended hours and overtime, which puts them at risk for making mistakes. A recent survey showed that 47% of nurses reported working regular overtime.
What is your organisation's policy on this? Do you think that regular overtime is acceptable?
We know that nurses should not work more than 40 hours a week, and we believe they should work no more than 12 hours in a day, ideally less, because you reach a point where you start to have cognitive decline. It also creates situations where nurses start to treat each other poorly.
What are some challenges that nurses face that people might not be aware of?
I would have to say workplace violence and bullying and harassment. A report that came out last year from the Government Accountability Office found that healthcare workers in inpatient facilities such as hospitals experienced high rates of non-fatal injuries such as hitting, kicking and beating. Nurses also regularly experience bullying and harassment. The report I just mentioned found that 71% of nurses said that they had been harassed by a patient, which is far lower than the percentage reported by physicians.